Your primary focus with your practice is cataracts, of course.
Correct.
The cataractsurgeons.com is kind of what you guys are known for. But pretty interesting that you were in the hot seat recently. You recently had the surgery, and definitely want to talk about your experience today.
Yeah, it was, so about 10 years ago, I'm a little nearsighted with a little bit of astigmatism, and I thought about having LASIK or PRK, and this was maybe 15 years ago. And so one of my colleagues, Dr. Luca, who works with me in Portico, I had him do an exam on me, and he was refracting me, and then he looked at me, he's like, "Oh, you got a cataract." And I was like, "No, I don't. I don't have a cataract." Sure enough, dilated me. We took some pictures, and I looked, and I had this haziness to my lens, my right eye off to the periphery. And what had happened was, when I was about 12 years old, my brother shot me in the eye with a bottle rocket. I know that sounds awful. He didn't mean to, but I still give him grief about it to this day. And of course, it was a traumatic event. I ended up with a hyphema. It was a pretty significant trauma. And so obviously that cleared up. And ever since then, my pupils have been slightly a different size from each other. But my vision's always been fine, and I've corrected very well. And when Dr. Luca found that, I decided not to do anything, because any type of surgery like that would simply make the cataract worse a little bit faster. Well, over the past several years, as I've gotten older, and I'm only 52, I know to you that's much older, but 52 in the cataract surgery realm is not old at all.
Right.
And but over the past few years, I've had more glare at nighttime. And the biggest symptom actually is very interesting. If we're sitting in the kitchen, my wife is sitting in front of like the window, and the light's coming through, it's just a lot of glare. It would just really wash out images, and so that plus the nighttime driving without glare, it was just driving me crazy.
Yeah.
So, and the funny thing is, I've been talking to Dr. Coleman about this for years. And it always is a little nerve-wracking when we operate on friends, family, colleagues. And so, of course, Dr. Coleman, one of the reasons I brought him in with me is because he's such a good surgeon and somewhat teachable, And so I wasn't going to let anybody else do it. And when he became comfortable, we talked about it, the symptoms were bad enough. I went through the entire process, the preoperative measurements, the lens selection, which lens am I going to go with. And then I had it done 1 month ago today. Cool. And I tell you, we truly, even though my vision wasn't horribly bad, it is amazing how much better it is. And like I said, I've always been a little nearsighted with a little bit of astigmatism. My distance vision has never been this good. It is astonishing how much better I see. And it's so good that I'm contemplating doing something with this eye to kind of balance them out.
So since you've had when you were 12 years old, that trauma, it kind of sped up the process. So the other one isn't nearly as bad.
No. It's kind of a normal lens change as you would see at my age. But what's interesting, even at 52, like when I compare the two eyes, using them together, it's amazing. Using them independently, like with the right eye, everything's very bright. Colors are very real, vivid, they pop out. And with the left eye, there's just a faint, almost yellowish tint. It's not bad, but and like I said, with both eyes together, I don't notice anything. But when I compare the two, there's this subtle difference. It's pretty neat.
Really
and these are things that patients have told me for years.
Right.
And that I told other patients that they're going to experience. But now that I've gone through it, it's like, wow, okay.
You're like, yes, it's
real. We weren't lying. Yeah, exactly. I'm not lying to these people. That this is, it's amazing. And the procedure, first of all, the surgery center is amazing. Of course, I guess they considered me a VIP. But I don't think they treated me any differently than they treat any other patient. And so it was, we have an amazing staff, which I've always known that. But being on the patient end of it, they're very reassuring. They're wonderful at starting the IV. Of course, like we were talking about earlier, I got a little sedation. I wanted just enough to not really care, but also not to give away any of the secrets. And I had the lens X laser done, and that was actually very interesting. I tell patients all the time it's going to be like a kaleidoscope of shapes and colors, which it was. And the most uncomfortable part was there's a little suction that happens with the laser, but it's not bad at all. You feel a little bit of pressure. when the laser is making all the cuts, it's this swirled kaleidoscope pattern. It's pretty interesting. And then getting underneath the microscope for the surgery itself, you feel a lot of fluid. There's just a lot of water, a lot of irrigation. You're looking at these 3 lights that go between light and black. And my whole goal was to focus on those lights, and I could hear Dr. Coleman talking to me with every step that he was doing. Of course, I knew I was trying not to intervene, and I wasn't trying to give him any direction at all. And it took about 8 to 9 minutes, wasn't long at all.
Wow,
and then immediately afterwards, what's interesting is things are brighter, more colorful. Of course, you're dilated, and I could tell with each step what was going on. Like there was some swelling in the cornea because I could see halos around lights, things like that. I got to put on the post-operative glasses.
So fun. Love it. Yeah, very cool. And the interesting thing is a lot of people think it's something that affects everybody, even the one that is performing the surgery. So it's cool to hear your perspective.